Hello, everyone. Well, we hope you enjoyed all the afternoon concurrent sessions that you attended, and I'd like to welcome you back to our final sessions today, beginning with Dr. Eileen FitzPatrick's presentation, Coming Out of COVID, Baby-Friendly USA, focused on the new guidelines that support safe and competent care. So just a quick introduction for Dr. FitzPatrick. Dr. FitzPatrick is a Doctor of Philosophy, Master of Public Health, and a registered dietitian, and is the CEO of Baby-Friendly USA, Incorporated. Dr. FitzPatrick's doctoral work focused on maternity care practices and breastfeeding, and her wide-ranging experience in the field includes coordinating the initial statewide Breastfeeding Quality Improvement in Hospitals project in New York through her work with the Obesity Prevention Program with the New York State Department of Health, and playing a leadership role in the Breastfeeding Friendly project in Erie County, which was initiated and developed from her field research. Most recently, Dr. FitzPatrick was the faculty and chair of the Russell Sage College Nutrition Science Department. Today, Dr. FitzPatrick will speak to us about Baby-Friendly USA's vision for the coming years, with a focus on the rollout of the updated guidelines and evaluation criteria, GEC. The session will also recognize the hospitals in Mississippi who have achieved baby-friendly designation since the 2019 CHAMPS conference. So please help us congratulate these hospitals when it comes to that time through comments in the chat box and by sending in those little claps that you see on the bottom right corner of the live stream as well. During the session, you can enter any questions you have for Dr. FitzPatrick into the Q&A, and we will address as many as possible at the end of the session. Thank you. So without further ado, pass it off to Dr. FitzPatrick. Thank you.
Thank you very much. And thank you for the opportunity to speak to you all today. I'm very appreciative of that opportunity, as well as the participation in this wonderful conference. So I do disclose that I am employed with Baby-Friendly USA. I am the current CEO, but I have no other conflicts of interest to disclose. So here's an overview of my presentation today. I want to highlight the vision and value of Baby-Friendly, a little bit about Baby-Friendly in the US, as well as some coming out of COVID stories from our designated facilities, which I'm sure all of you may have some of those coming out of COVID stories, but they're specific to some of our designated facilities, which I think is important to share. Updates on our assessments that are ongoing, as well as the Baby-Friendly USA new guidelines and evaluation criteria that will be released this summer. And finally, a big shout out to those newly designated baby-friendly hospitals in Mississippi, which I will name specifically at the end of this presentation. So the vision of Baby-Friendly is culture change in maternity care that results in the provision of the highest standard of infant feeding and care. And I will focus today on some of the specifics that we are very proud to be putting forth, and that's a higher focus or a more specific focus on safe implementation of practice, effective communication with mothers, as well as reduction and elimination of breastfeeding disparities. So one of the a statement of value that Baby-Friendly provides. So Baby-Friendly designation ensures ongoing staff training and lasting culture change that improves health outcomes and increases patient satisfaction. So it's important to think about the value of Baby-Friendly designation, and I will highlight some of those issues moving forward. So Baby-Friendly designation results in the highest level of evidence-based practice. And the reason that occurs is the accountability that Baby-Friendly USA provides. So we certainly provide required practice audits used for quality improvement. And we can certainly report that hospital self-assessments tend to overestimate the degree of compliance with the 10 steps. And this was very, very graphically displayed in a recent published article that looked at hospital self-evaluation and external evaluation of the practices. And as you can see from here, so the self-evaluation by the hospitals are the gray bars, and the external evaluation is listed here in the darker bars. And for every step, except steps 3 and steps 10, the self-evaluation was significantly higher than the external evaluation. So external evaluation is definitely more objective than internal monitoring. And it's important to note that the third-party certification of an organization like Baby Friendly USA provides an external verification of quality and safety based on established standards and holds facilities accountable. And it improves practice. The practices are better with that external accountability. And here you can see this is data from Texas that demonstrates that breastfeeding metrics are also improved with designation. As you can see here, these were non-Texas 10-step, non-baby friendly hospitals, then the Texas 10-step hospitals, and here the baby friendly designated facilities were listed here, and exclusive breastfeeding was significantly higher in those baby friendly hospital designated facilities. And so it's interesting to think about, the award may be the motivation for hospitals to achieve that designation, but it's really the accountability that makes a difference in the breastfeeding metrics and the degree of compliance with practices. So the baby-friendly designation process provides support, and I wanted to highlight this. And when I speak about the experiences of our hospitals during COVID, hopefully this will, be clear. So the resources that we provide include practice audit tools for each of the 10 steps for self-assessment, continuous quality improvement activities, and technical assistance. And the accountability that we provide are the required tracking and submission of data, the on-site, and in the case of this year and last year, the virtual assessment of practices, as well as the required improvement activities when non-compliance of practices is determined. And I'd like to share with you this quote, baby-friendly hospital initiative process was hard, but worth it. I hope you can all agree with me. This was a quote from a paper, the Burnham et al. Paper that just came out. It was interviews of Mississippi nurses who had gone through the process, and we're very excited to share this. And we completely agree that the process is hard, but definitely worth it. So after designation, although achieving baby-friendly designation is an important part of the journey, it's not the end point. And ongoing data collection, monitoring of practices, and quality improvement activities are vital for ensuring that the baby-friendly standards are maintained. And post-designation facilities are responsible for the ongoing adherence to current guidelines and evaluation criteria. And that maintains practice, so really important. So a little bit more about the focus on safe implementation of practices. I think it's important to note that baby-friendly protocols are designed to support individualized care and appropriate clinical decision-making, not inflexibility or rigid adherence to the steps at all cost. Baby Friendly USA is dedicated to addressing concerns and providing support for the safe implementation of care. And to demonstrate this in the new updated guidelines and evaluation criteria, there is guidance for safe implementation for each step, and you will be able to see that in that document when it's released this summer. So healthcare facilities can make a huge difference in newborn events by incorporating prevention methods such as family awareness, staff monitoring, and education for both staffs and family. So a continued focus on reduction in health disparities is part of Baby Friendly USA's mission. This is data from CDC that showed that the disparity between white and black initiation breastfeeding was 16.5%, which is very large and disconcerting. And this was the data below this here is with the implementation of the Baby Friendly designation required 10 steps, it was reported that disparity in breastfeeding initiation between black and white infants decreased by 9.6%. And that's the Meerwood et al. Paper from 2019. And so we certainly feel that the aim of Baby Friendly USA designation and implementation of the practices is the equitable delivery of care. And we are moving toward that goal. So a little bit about Baby Friendly in the US. So I like to show this graphic. This is the percent of births at baby-friendly designated facilities. and the percent ever breastfed, which is breastfeeding initiation in the hospital. And you can see they are highly correlated, which we're very proud of. Currently, Baby Friendly USA, the designated number of designated facilities, there's 590. That translates to over 1 million babies, or 28% of U.S. births occurring in baby-friendly designated facilities. And you can see that there are additional hospitals and birthing centers working towards designation. So currently, Baby Friendly USA is working with over 1,000 facilities to support their baby-friendly journey. So coming out of COVID, I'd like to just highlight a few of the stories from our hospitals. I'm sure for those facilities and representatives of facilities that are on the call, COVID was a really challenging time. But I think it's important to reflect on the lessons learned, as well as how our designated facilities have really persevered and kept practices in place as much as possible. So certainly we understand how challenging the last year or year and a half has been for hospitals. Our designated facilities have expressed concerns about, finances, alter processes for infection control, location changes and consolidation of services, as well as staffing issues with turnover and also illness. So during this period, Baby Friendly USA provided emergency accommodations for facilities. When appropriate and necessary, we created practice update calls to aid facilities to get practices back on track after COVID disruptions, which affected a tremendous number of facilities. And we continued to conduct these hospital support calls to help facilities get their practices back on track. So some of the stories shared with us from our designated facilities and our facilities in the process is that the breast milk was very valued by mothers during this time frame for the antibodies and immunological benefit, and that there was anecdotal evidence of mothers that were not planning on breastfeeding, but that opted to pump to supply antibodies to protect their infants. So there are some, really heartening stories that occurred during this time frame. Rooming in, it was challenging at the beginning while COVID recommendations and protocols were established, and it turned out that keeping mothers and babies together was the safest place for them. With reduced visitors, or for some facilities, no visitors, mothers were more rested. They had increased opportunities for skin to skin and increased opportunities for breastfeeding sessions. So many of our facilities were reporting increase in exclusive breastfeeding as a result of this. So it's a silver lining, not something that we would want to repeat, but there is some silver lining to this story. Many hospitals reported discharging mothers soon after birth. The CDC MPINC summer COVID survey that occurred last summer reported that many hospitals were discharging mothers within 48 hours after birth. And many of our hospitals actually reported discharging mothers within 24 hours. It makes it very challenging to provide sufficient breastfeeding education, counseling, and support if you're discharging mothers within 24 hours of birth. And so to continue a little further, talking about some of the experiences of these hospitals, location moves to accommodate COVID patients. Some maternity care services moved from one floor to another, and some to even a different building. And I'd like to share with you, one hospital reported that they actually had to move twice. They moved to a different building to accommodate COVID patients and moved back. And then when the second wave of COVID occurred, they had to move again. So they had moved twice, which is really challenging to maintain certainly your practices. Staffing, there's reported reduction in lactation support from the CDC MPINC COVID survey. 1 in 5 hospitals reported that in-person lactation support had decreased. And some of the stories that our hospitals have shared with us were that the lactation staff had been furloughed, and one facility even said their entire lactation department had been laid off. Reports of ill and quarantine staff, staffing shortages and turnover, visiting nurses and National Guard nurses that weren't really very well trained in breastfeeding or in the 10 steps made continuation of practices challenging, to say the least. And there was also staff provider reassignment, pediatricians moving from the adult COVID floors and then the neonatologist covering the well baby unit. And some of our hospitals did report increase in formula supplementation. However, despite all this, I really have to applaud all the hospitals out there, and certainly our baby-friendly hospitals, that despite this adversity, the hospitals demonstrated dedication and commitment to the baby-friendly practices and to their baby-friendly designation, and worked very hard during this time to ensure that their mothers and babies got the best care possible. So to transition here to Baby-Friendly USA updates, I'm going to update you both on the assessments and the new guidelines and evaluation criteria release. So let's start with the virtual assessments. So we completely restructured our accreditation, reaccreditation assessments to provide them virtually during 2021 and now through 2021, during 2020 and through 2021. So I have a poll question, which will be launched. The question is, have you been through a Baby-Friendly USA virtual assessment with your facility? And so the options are yes or no. And so I'll return to the answers to this once the poll is complete. I will continue though with my presentation. So just to give you an overview of the virtual assessment. So we're using the technologies through Microsoft and include OneDrive and Microsoft Teams. Microsoft OneDrive is for uploading any materials that need to be reviewed, and Microsoft Teams is being used for all interviews. You do not need to have the license for these. We provide you the links for both of these aspects of the virtual assessment. Here's an overview of the virtual assessment from a programmatic view. There is separate part 1 and part 2 for our assessments. As you can see here, part 1 includes the administrative interviews, the leadership interviews, purchasing agent verification of the fair market price, the healthcare provider and nursing staff interviews, as well as the materials review, and that would include the infant feeding policy, patient education materials, and the training curriculums. For part 2, it includes the mothers' interviews. And so those mothers interviewed would be pregnant mothers if there's an affiliated prenatal service with your facility, postpartum mothers, and also mothers of infants in special care. And then also there's an observation section, and the observations include photographs that would be uploaded that provide the evidence that the 10 steps required signage are posted in your facility, and also the formula storage, so for the well baby and the NICU. And then finally in part 2 is if there's any components of part 1 that were found to be out of compliance, they would be reassessed in part 2. So the current assessment status is listed here. We've done more than 80 part 1 virtual assessments, and these are ongoing. So if you are a hospital that's ready for an assessment, please submit your request letter and we would be happy to virtually assess you for baby-friendly designation. For part 2, we're currently scheduling part 2. So if you are ready for part 2, we can certainly accommodate you. Our actual part 2 assessments start this week, and we will be completing those through the end of the year. And then for 2022, our assessments will likely be a hybrid model. I believe we will be completing the virtual assessment part 1s virtually. We've gotten a lot of very positive feedback from facilities who have experienced that, and so those will be virtual, but the part 2s will be in-person on-site visit. So I'll ask if the results to the poll are ready, that we could share those. I'm not sure if there was. Maybe, there we go.
We are having a bit of technical difficulties with the poll, so to be announced. Yes,
that's fine. We will continue without it. Thank you very much. All right. So moving past assessments to our new guidelines and evaluation criteria. And so we are so excited to announce the release of this document in 2021. It will be released this July, this summer. And it has been a long time in coming, but it has been well worth the wait. So our new guidelines and evaluation criteria are based on the 2018 BFHI implementation guidance from the World Health Organization and UNICEF, which is this document shown here. We certainly consulted numerous groups regarding our new guidelines and evaluation criteria, and that includes 2 expert panels as well as review by major medical and health associations, including the American Academy of Medicine, the American Academy of Pediatrics, the Nurses Association, the lactation consultants, American Academy of Breastfeeding Medicine. So there were a number of large groups, medical groups and health groups that provided feedback on our new guidelines and evaluation criteria. So many of you have seen this already, the changes to the 10 steps that the World Health Organization, UNICEF released. As you can see, the changes are in red, but I also want to put hospitals and birthing facilities at ease that there's a lot that remained the same. So it's not going to be completely different. So a lot of what you are doing so far is likely to continue. I will highlight just briefly the step 2 changes because this might be the one that's most likely to cause anxiety or pose a challenge for some hospitals and birthing facilities. So there's definitely a paradigm shift for step 2. So instead of just training, we're really looking at competency verification. And I wanted to touch base here and define competency. And competency is defined as the capability to use a set of related knowledge, skills, and behaviors to successfully perform identified jobs, roles, or responsibilities. So it's important to differentiate, training and learning objectives, which is really the goals of an educational experience, and competency, which is the result of training that results in what the person is capable of doing, right? So doing or the outcome. So there are a lot of the performance indicators that measure competencies in this new document that evaluate foundational skills. And many of these foundational skills are related to counseling and patient interactions. So communicating in a credible and effective way. And so I'm just going to highlight one of the performance indicators here, performance indicator 11. And that performance indicator is for the provider, the staff, to demonstrate at least 3 aspects of listening and learning skills when talking with a mother. And you can see here, and this is from the World Health Organization UNICEF document, but ours will be similar, that there are performance indicators listed here with the expected answers. So the answers are listed here. And there are responses or practices of concern. So these are answers that would be not supportive of the performance indicator or not demonstrate competency for that performance indicator. And then there are recommended resources for each of these that provide the evidence base that support the recommended responses. So I think it's important to note that the WHO breastfeeding counseling definition is a process and interaction between counselors and pregnant women or mothers. So Baby Friendly USA definitely supports the shared decision-making model, a form of non-directive counseling in which division of power shifts the conversation from giving patient education to exchanging information to help the family and the mother reach their goals and make the decision as to how to feed their baby. So Baby-Friendly USA's new guidelines and evaluation criteria really focus on this component and enhancing the counseling that occurs with mothers and highlighting the importance of these meaningful conversations that deliver compassionate care, consider others' perspectives, collaborate, compromise, and celebrate when a mother or family decides on how their informed decision as to how to feed their baby. So staff requirements for competency verification with training where knowledge deficits are identified is crucial to safely and compassionately implementing the practices that support breastfeeding that are embodied in the 10 steps to successful breastfeeding. So I think we can all agree that babies are born to breastfeed. So love just to say that. And also to thank all of the facilities, provide a million thanks from more than 1 million mothers and babies you care for. And with that, I would like to go on to congratulate the CHAMPS hospitals that have been designated since 2019. And so we're so excited to be part of this conference and congratulate these hospitals. It is quite an achievement. I highlighted the quote earlier, that process is hard, but well worth it. So I'd like to start here with Highland Community Hospital. They were designated in November 2019. Congratulations. The Merit Health Biloxi, designated November 2019. Also, congratulations. The Mississippi Baptist Medical Center, designated December 2019. Congratulations to all of you. Southwest Mississippi Regional Medical Center, December 2019. Congratulations. Methodist Le Bonheur Healthcare Olive Branch, December 2019. Again, congratulations also to you. North Mississippi Medical Center Tupelo, designated March 2020. Congratulations. North Mississippi Medical Center Gilmore Armory, March 2020, designated. Congratulations. Memorial Hospital at Gulfport, designated July 2020. Congratulations. And last but not least, Ocean Springs Hospital, designated in August 2020. We are so excited that your baby-friendly journey achieved designation, the highest standard for infant feeding and care. And we look forward to your continued baby-friendly journey as a designated hospital. So congratulations. And at this point, I will conclude my presentation and would be happy to answer any questions.
Great. Well, thank you so much for your presentation and for all of your work with Baby-Friendly USA. We had one question, and if you have others,
Sure.
We have a little bit of time, so feel free to chat those in. But one participant asked, with baby-friendly facilities, do you all require your pediatricians to undergo breastfeeding training or reframe their approach to including formula in the take-home package? I'm wondering if you could speak to that.
Okay, I'm sorry. Could you repeat that again? I missed the end part.
Okay,
I see. Oh, I see that. I see the question. I can read it. So,
okay, great.
Baby-friendly, do you require all pediatricians to undergo breastfeeding training or reframe their approach to including formula in the take-home package? Well, so provision of formula is inconsistent with our guidelines and evaluation criteria. So we would not want to be providing take-home formula unless it was, medically indicated. The pediatricians, providers are required currently to have 3 hours of training. However, in the new guidelines and evaluation criteria, since, as I said, it's going to be competency-based, and they will have to, answer some questions during the interview that demonstrates or at least verify that their competency has been verified. Does that answer your question? Hopefully.
Yes, I believe it does. Well, I don't see any more questions, so I think that we will move on to the closing session now. But thank you so much, Dr. FitzPatrick, for being
Thank
here
you.
with us today.